Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio this afternoon is world-renowned pediatric gastroenterologist, research scientist, and entrepreneur, Dr. Alessio Fasano. He founded the Center for Celiac Research and Treatment in 1996. His visionary research has led to the awareness of celiac disease as a growing public health problem here in the United States. He's going to be visiting Australia April the 22nd through the 24th at the 4th Bioceuticals Research Symposium entitled Revolutionary Strategies for Complex Diseases. The symposium highlights the latest treatment options for leaky gut, autoimmune diseases, covering a range of fields, and Dr. Fasano is going to be there as a key speaker. Welcome to Health Professional Radio, Dr. Fasano.
Thank you for having me on the show.
Thank you. Now, you are the author of Gluten Freedom, a book that examines the groundbreaking roadmap to a gluten-free lifestyle. And also, you say that treating celiac disease could provide clues to treating symptoms for other autoimmune diseases, because celiac disease is the only autoimmune disease that we have a treatment for, as you said in another segment. Is that correct, Doctor?
Yes, you are. Sometimes it's very difficult to really understand how this autoimmune disease they materialize, and therefore how you can approach for treatment and ideally prevention. Mm-hmm. And the reason why, because there are many variables that you can't control. Celiac disease still is very difficult to study, but there are many. The number of variables are much lower, and therefore you can really have a better understanding of the intimate mechanisms that eventually lead to autoimmunity, and then this kind of knowledge can be extrapolated to other autoimmune diseases like diabetes, MS, rheumatoid arthritis, IBD, and so on and so forth.
Do you see a prevalence of celiac disease in one age group or another, or in one region of the country or the world, as for that matter?
We did at the beginning. As a matter of fact, this was believed to be a disease that was pretty much confined in North Europe and affecting only kids. Now we understand that there's a global village of celiac disease because there is no sex, no age, no race, no corner in the world that is spared by celiac disease, provided that the two key elements, i.e. the genetic predisposition and the ingestion of gluten-containing grains, are there.
Now, you've discovered that intestinal permeability or leaky gut, is that what it's commonly known as? That's a common denominator in many autoimmune diseases?
Correct. This was the kind of information that we were able to acquire by using celiac disease as a prototype of autoimmune diseases. And, when we learned that, that was a key element because, physiologically, we always wonder how big molecules that will instigate an immune response that leads to autoimmunity can get access in our body when we have barriers that prevent this to happen, how this can be. And, the question was resolved when we learned that, again, celiac disease, and now we learn that there are many other autoimmune diseases in which there is this common denominator of loss of barrier function are part of the equation that will lead to loss of tolerance and then autoimmunity. So now I believe it's generally accepted that this barrier function is a key element of the pathogenesis. And there are pretty strong evidence in many autoimmune diseases that it's part of the machinery that leads to the autoimmune process.
Now, is the treatment for celiac the same no matter who is suffering from the disease, or does the treatment vary based on levels of celiac, or is there even such a thing as levels of the disease?
Well, actually, the treatment is the same for everybody. So everybody that is affected by disease has to be on a gluten-free diet in order to control the symptoms. Of course, the severity of the disease varies from individual to individual, and therefore the efficacy of the treatment in terms of, amelioration symptoms and or the timing to resolution symptoms may really change from one individual to another.
As the author of Gluten Freedom, will you be discussing some of the chapters in your book when you visit the 4th Bioceuticals Symposium in Sydney, Australia this year?
Yes, we definitely will.
You say previously symptoms were recognized in a very small number of people. What was it that led to this discovery of so many more people having this disease and to it not just being limited to children?
Well, this kind of discoveries went vis-a-vis with the availability of more and more robust screening tools, and when we were able to eventually have good and reliable tests, we started with screening the people that they were at risk, like family members. This has been an autoimmune disease. We knew that there was an increased risk in family members, and then we start to expand this tests to people at risk because they have signs or symptoms that have been linked to celiac disease. And then eventually we expand this to the general population, and that's how we learn, the wealth of symptoms that people that can really present with this disease, including people that they are totally asymptomatic, so they don't have symptoms yet, and they are already affected by the autoimmune process.
What type of reception have you received concerning your new research as it relates to gut permeability? And do you feel that healthcare professionals in Australia will be more receptive, less receptive, or is the information going to speak for itself?
Well, the destiny of when you stumble upon transformational research, so in other words, something that brings you a new, paradigm of science, a place where never been before, is that skepticism is the way that in general, your research will be, eventually, approached with, and therefore, at the beginning, this idea that you can even consider that an autoimmune disease can be treated by treating the gut permeability was really an object of tremendous amount of debate and criticism. In the past 10 years, the field has moved more forward, and there's more and more acceptance there. I have to say, because I've been in Australia several times, invited to talk on the topics, that I found this Australian healthcare professional landscape much more receptive to and open-minded to new, paradigm of science. So I will expect that the same is going to happen in April.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Our guest has been Dr. Alessio Fasano, world-renowned pediatric gastroenterologist, research scientist, entrepreneur, and also author of Gluten Freedom. He's going to be a keynote speaker at the 4th Bioceutical Symposium entitled Revolutionary Strategies for Complex Diseases, happening in Sydney, Australia, April the 22nd through the 24th of this year. It's been great having you here with us this afternoon, Dr. Fasano.
Thank you for having me on the show.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.